Good day, it's Dr. Rapiti. It's April the 24th, 2024, and today I want to talk about something that affects almost every woman in the world, and that is neglected. I've spoken about it before, but I have patients who can be a testimony to what I've been saying. She's 42 years old. She has had all the symptoms of perimenopause, and perimenopause is that period after you're a young woman, you have regular periods, you suddenly find that you have symptoms of hot flushes, and you have fluctuation in moods. You're very volatile in your behavior. You get off on a tangent, or you scream for no reason. You're unpleasant. You cry for no reason. And of course, you might have what we call urogenital symptoms. And she's 42. And what's been taught in medical literature, what it would appear, is that you should not treat with hormones, which I think is incorrect, because what is happening during the perimenopausal period, the hormones is not being released in a regular manner that it should be for you to get a regular period. So it fluctuates. If the hormones become too little, you tend to get miserable. You get you have a loss of sleep. Insomnia is a serious issue, and why we're serious about treating this properly is that it affects the quality of life of the individual in a home space, in a workspace, and in a space of her social circumstances. She's not a happy person to be with. She's not happy with herself. And many women are unaware that the reason for the sudden change in behavior is because of the decline or irregular release of the hormone level. It takes about 10 years for the hormones to completely, literally disappear. But in that 10 years' time, you're miserable if you don't get treatment. I believe we should be treating it. I have treated patients, and yet to tell us her experience, what she felt like before she was in treatment, and what she's feeling like. So tell me, ma'am, how do you feel before you came to me on treatment? What was your experience?
Continuous tiredness, sex drive that's low, vaginal dryness, as well as lack of sleep. You no matter how much you sleep, it's just not enough. And I was thinking something's wrong with me. I told doctor that I feel like I'm going out of my mind here. And he even spoke to my husband with regards to this and explained to him that it's menopause that's starting and these changes in women. It's not that you're getting it elsewhere. It's just the fact that your body's going through a change that nobody's like really aware of. And doctor educated me and he prescribed something that's really helped. And I'm looking forward to what he still has in store because it's helped me so far.
How do you feel after you've been on tablets?
I feel much better. I feel well rested. I'm flourishing at work and I feel energetic and I feel like I've got my a spring in my step. I've got my young body back.
How's your work relationships now ever since you've been put on treatment?
Much better. Everything at work is so positive and I've got a better outlook on doing things. I'm not feeling so irritated at everything. So I would say doctor gave me the best advice and
Yeah, well, good. Well, here's testimony to what I was saying, and that by ignoring to treat women or denying them treatment that is available, we're making them suffer. We're making their relationships at home suffer. We make their work performance suffer. Then they become social misfits. And this has been happening for 30 years because there's been a myth that using hormones like estrogens can predispose one to cancer. There's absolutely no evidence for this. On the contrary, they found that if you use estrogens, it actually decreases the incidence of cancer. I've mentioned before, endometrial cancer went down by 20%, ovarian cancer went down by 40%. It improves one's quality of life. And the important thing is that you don't end up taking 30 other medications when just one pill can solve the problem. Well, folks, there you have it. So think carefully about it and don't dismiss it. Menopause is a serious condition that should be treated and not be ignored. Complementary medicine works maybe to some extent, but not as well as replacing it with the correcting and that is the hormones. Thank you very much, Dr. Rapiti.